Our featured speaker is an author, radio personality, and speaker for the Foundation for Wellness Professionals, a member of the American Academy of Anti-Aging Medicine and American Academy of Environmental Medicine. He's also board-certified clinical nutritionist. Please welcome the founder of Vitality Healthcare, Dr. Stephen T. Osterhout.
I'd like to thank Harvard and the Harvard Faculty Club for making this possible today. What do you do if you're diagnosed with type 1 diabetes at age 12 and have open heart surgery at age 20? You figure out why. My early impression of life was growing up with symptoms and thinking, this must be how the body works. Constant headaches, fatigue, stomach aches, allergies, and the hope that insurance would cover more of the prescription than less. The illusion that I started to consider is that my body was incapable of managing itself, and symptoms were a normal complication of life. I was sick and getting sicker every year. When I was diagnosed with diabetes at 12, I believed I had acquired my one major illness. I was certain that I met my disease quota for a lifetime. Besides, my doctor said there was a cure right around the corner. That was over 30 years ago. Unbeknownst to me, I was participating in a model of sick care. I diligently visited my gastroenterologist, neurologist, and endocrinologist to band-aid my symptoms. And I appreciated their help. But I knew that I wasn't supposed to be like this. I wasn't supposed to be fragile. I wasn't supposed to always be navigating illnesses and full of fear of when my body was going to let me down next. The peak of the sick care model for me was when I had open heart surgery at age 20. I was told it would be the resolution for my poor health. But to my considerable disappointment, the procedure didn't help. When my doctor suggested the next recommended course of treatment was the newest antidepressant on the market, I knew what I had to do. I needed to find answers. I had to find solutions to why we get sick. At the time, I was a sophomore at Western Michigan University. I immediately transferred out of the engineering program and went directly into the pre-med program. I started to investigate other categories of medicine. I studied Ayurvedic medicine in India, natural healing in Brazil, and I spent my summers in Mexico at one of the best cancer clinics in the world. I witnessed firsthand how there are root causes to every illness. I've been around the world investigating, participating, and cultivating what authentic healthcare models should be. The reality is, our bodies are made to heal. They have a unique intelligence, but the laws of physics still apply. The body can't perform its responsibilities if the variables that sabotage its function are not reduced or eliminated. My intention from early in my career was to collaborate with traditional medicine, implementing the technology and emergency capabilities to address those alarming high blood pressures, high blood sugars, and migraines, while in the background identifying, detoxifying, and healing the underlying reasons why they exist. I created one of the Midwest's largest integrated medical and natural healing centers called Vitality Healthcare. This is where we strive to help patients overcome the illusions of health that seem to be so prevalent in society. Understanding that we are not powerless and victims to a body that is poorly made. Realizing that lifestyle choices, environmental stressors, and genetic predispositions dictate what symptoms are seen and how soon they'll be expressed. After graduating with my doctorate some years ago, I thought to myself, if only my healthcare providers would have looked for causes and not just treated symptoms. My life is a testament to what an integrated healthcare approach can accomplish. I've overcome 95% of my past health challenges. My reward is that I can help others do the same. I can make their experience less daunting, less intimidating, and ultimately very rewarding. I offer hope and health to those who are ready for change.